Hello and welcome everyone. I'm Dr. Sirdifield. I'm a research fellow at the University of Lincoln and I'm here today to talk to you about mental health in probation. Now, I've spoken to CEP about mental health in probation in the past, so I'm going to try not to repeat too much of that today. I thought I would briefly focus on why it's important to look at mental health in probation, then talk about probation's health-related role in England and Wales, and then focus on some recent research on the mental health of people under probation supervision and the support that's available to them, and then finish with some points for discussion. Okay, so I wanted to start by briefly considering why it's important to focus on mental health in probation practice. And here I'm talking about the health of people under supervision rather than the health of staff. So I think for probation staff, one of the main reasons to focus on the mental health of people that they supervise is that it can support their rehabilitation. But also there's a need to consider whether mental health treatment requirements should be part of somebody's sentence, and I'll talk a little bit more about what they are later. There are also some wider reasons why a focus on mental health is important, like the idea of making every contact matter, and that contact with probation provides a good opportunity to try to improve the mental health of people that are often disengaged from services, and that by doing that we'll be reducing health inequalities and potentially reducing reoffending and creating a safer society. Here I've set out the health-related role that's described in the National Probation Service's Health and Social Care Strategy. So as you might be aware, probation in England and Wales has been split into the National Probation Service, which managed high-risk cases, and community rehabilitation companies, which managed medium and low-risk cases. But it's recently been reunified, and this strategy is due to be updated next year, and it provides some helpful context. So in terms of probation's role, you can see that the strategy talks about things like considering the relationship between mental health needs and offending behaviour in sentence planning, encouraging people to access support, and supporting the development of pathways into services for people under probation supervision, and that includes improving the continuity of care between prison and probation. This slide shows the objectives for mental health, suicide prevention, and the offender personality disorder pathway in more detail. And you can see that alongside some of the things that I've already mentioned, it talks about making sure that staff are adequately trained, informing local commissioners about the needs of the probation population so that they could consider this when deciding what to fund, and working with healthcare partners to ensure best practice and joined up provision. So that tells you something about probation's role, but my next question is, what do we know about the mental health needs of people on probation, and are those people getting the support that they need? Well, this is a growing area of interest, but I would say we have a way to go in answering those questions. So I recently conducted a systematic review along with some colleagues where we were looking to identify what the literature tells us about the most effective approaches to improving health outcomes for adults on probation. And we also wanted to identify any studies around the health needs of people on probation. And it's a really challenging area to do research in, and there weren't many research studies around effective approaches to improving mental health outcomes. There were some background papers around mental illness in probation caseloads though, and whilst there was variation between these studies in terms of exactly which probation populations they focused on and which methods they used, it's clear from the studies overall that there's a high prevalence and complexity of mental illness amongst people on probation. Now, I was part of a prevalence study led by Professor Charlie Brooker, which formed the basis of my PhD, and here we screened a stratified random sample of people on probation in one county in England. And the graphic here shows our findings. So you can see that overall 39% of the sample had a current mental illness and almost half had a past or a lifetime disorder. The most common current disorders were mood and anxiety disorders, And we also showed that there was a high rate of dual diagnosis, as 72% of those with a current mental illness also had a drug or alcohol problem. A group of studies have also been conducted in Ireland recently, and I've provided the link to those here. And probation officers completed measures based on their knowledge of people under their supervision. And overall, these studies found that at least 40% of the caseloads had symptoms indicating a mental health problem, so very similar to the figure of 39% that we found in the study I've just discussed. And half of those people also had problems with substance misuse, family relationships, or were not in stable accommodation. So a complex set of needs. They also had limited engagement with mental health services, sometimes because they were unwilling to engage, but also sometimes because services were unwilling to take referrals from probation. And that starts to lead me into the next thing that I wanted to talk about, which is what support is available for people on probation with a mental illness. And here I think we need to improve the way that data around mental health needs are collected to inform commissioning decisions. And questions remain about the best way of doing that. There are lots of different factors to consider here, and I'm leading a research project around that at the moment. So we know that there's a high level of need, but what options do people on probation have in terms of accessing mental health treatment and support, and are they getting the help that they need? Well, as they're living in the community, in England and Wales, people on probation are expected to access healthcare in the same way as everyone else. But we know from the limited literature that there is on this topic that many people struggle with this for a variety of reasons. You only have to read the news to see that mental health services are struggling to meet demand, with long waiting lists and people having to travel long distances to access inpatient beds. And things like the Black Report, which was published recently around substance misuse in the UK, have shown that cuts have been made to resources for substance misuse services. Now, people on probation are often socially excluded and marginalised, and they can face additional barriers like not being registered with a GP, poor past experiences, or having a complex mixture of needs that don't meet the referral criteria for services. So, for example, people with a substance misuse problem not being able to access a mental health service because of that. A study that I led recently, looking at the response to the COVID-19 pandemic and probation, showed that in some cases, people were struggling to access services due to a digital divide. So many services were only able to offer telephone contact or video consultations and online support, but many people on probation were struggling to access care in this way because of things like a lack of phone credit or a lack of access to or understanding of technology. So although these additional barriers aren't a result of being on probation does provide a good opportunity to offer support and to engage people with services to support their rehabilitation. And it also provides an opportunity to collect data around needs that could then be shared with people that commission and provide services as a way of trying to ensure that the right kind of care is available to meet this population's needs. Sometimes people have received support whilst they were in prison, but no arrangements have been put in place to make sure that this continues when they're released onto probation. And a recent report from the Probation Inspectorate showed that only a third of people were being linked to the drug treatment that they needed after prison. And the UK government have now set up a Reconnect service, and there's a link to that here, to try to address this problem, but this service has yet to be evaluated. Another potential option is mental health treatment requirements, drug rehabilitation requirements, and alcohol treatment requirements, which can be added to a community sentence as an option at the court stage instead of someone being imprisoned. But at the moment, research shows that they're underused, and whilst there's been a push to increase their use, they're still only available in certain regions. And a recent report by the Probation Inspectorate in England and Wales showed that there's been a huge fall in the number of drug rehabilitation requirements being recommended at court. Another court-based option that's used elsewhere in the world, and I think is being evaluated here, is mental health courts. But again, we need to wait for these to be evaluated. And a paper's been published recently about an alternative to mental health treatment requirements, which was made available to people on a community rehabilitation company caseload in London. Now here everyone was screened using the Kessler-6 at induction, which is a brief screening tool for psychological distress. And anyone who scored 13 or more was classed as distressed and could be referred by probation staff to be assessed for 12 sessions of one-to-one CBT, which was delivered by a company called St Andrews Healthcare. And you can see the reference to that study here. It's an interesting model because it cuts out the need for a referral to be made at court, and it could be activated at any time during probation supervision. However, as you can see here, over the course of a year, 569 people were referred to the service. 529 of them were offered an assessment, but of these, just 301 actually showed up to complete the assessment, 291 of which were offered treatment, and just 75 of those completed all 12 sessions. So that's only about a quarter of people actually went on to complete all of the sessions in this study, so it tells you something about attrition when doing research in this field. But the study did find significant improvement across their pre and post measures of distress, mood and anxiety. Another option that's used in the US and that appears to have some potential is specialty probation officers. And you can see the characteristics of this model here. So these are officers that are trained in mental health and have reduced caseloads made up of people with mental illness. And I was really pleased recently to see that a paper has been published based on a randomised control trial of this intervention across 2 counties in a US state. As I said earlier, it's hard to do research in this area, and it's really great to see a trial taking place. But like the London study that I just spoke about, the Fowler study, it shows the difficulty of trialling a new intervention. So here 758 people were identified who were on probation in the 2 counties and screened positive for a mental health disorder based on a brief mental health screen. After a probation officer had talked to these people about the study, 32% were referred to the researchers as they were interested in taking part. A number of those then screened out for various reasons, and that left just 100 people in the trial. They were randomly allocated to either a specialty probation officer or a regular probation officer, and there were no significant differences in the characteristics of those 2 groups. And you can see the breakdown of mental health diagnosis here on the slide. So both regular and specialty probation officers were expected to follow up on any mental health needs for people on their caseload. And the study showed that this was more likely to happen in the specialty group. So these officers were more likely to do things like asking people to attend for a mental health assessment or to attend counselling than the regular probation officers were. It also showed that 79% of those with specialty probation officers completed the actions that had been set for them, compared to 50% of those on the standard caseload. So the impact on engagement with mental health services seems to be good, but the data on criminal justice outcomes in this study was a bit more mixed, and the researchers suggested that to improve these outcomes, projects needed to look more at the underlying causes as well as at mental health. A joint thematic inspection report has just been published, which looked at the criminal justice journey for people with mental health needs and disorders. And in this inspection, they studied over 300 cases and interviewed 550 professionals and 67 people with mental health problems and lived experience of the criminal justice system. And whilst the report does provide some examples of good practice, overall it highlights the number of improvements that need to be made to help people in the criminal justice system to get the mental health support that they need. It's a huge report, so I've tried to pick out some of the key messages to share here with a particular focus on probation. So the report states that mental health needs are being missed at every stage of the criminal justice system. And in a previous inspection conducted in 2009, the inspectors had recommended that a common definition of mental ill health should be used throughout the criminal justice system. But 12 years later, this still hasn't happened. And this means that there is no accurate picture of the numbers of people with mental health needs and disorders in the criminal justice system. So there's a need to review the arrangements for identifying people with a mental illness within the criminal justice system. And even when mental health needs are identified, the report suggests that information isn't always recorded consistently. So there are flags that can be used within probation systems, but they're not being used consistently. So again, that means that we don't have accurate pictures of the prevalence of mental illness within the criminal justice system. The inspection highlighted significant problems in information exchange that occur in every agency in the criminal justice system and at every stage of an individual's criminal justice journey. And the inspectors recommend a memorandum of understanding on information exchange between different agencies to try to address this problem. The use of mental health treatment requirements is increasing, but overall they're still vastly underused. And there are still problems with getting timely access to treatment and support after release from prison. So you can see here the report says that waiting lists for services in the community are long, leaving vulnerable people having to cope without the help that they need. And I was told about some figures on the number of acute psychiatric beds recently. And in 1992, when the Reid report was written, there were 70,000 beds available. In 2009, when the Bradley Review was published, there were 37,000, and in 2021, there are now only 17,000 acute psychiatric beds available. So as well as recommending increases in the availability of medium and high secure beds, the inspectors also recommended that local criminal justice boards should agree, produce and analyse cross-system data sets to inform commissioning decisions. So that relates back to what I spoke about earlier in terms of commissioning being informed by information on the prevalence of need within the criminal justice system. Also says that probation need to improve the quality of pre-sentence reports to ensure that they contain a comprehensive analysis of trauma, mental health needs, and where indicated, proposals for appropriate treatment. And the report also emphasised the importance of criminal justice staff developing rapport with people under supervision so that they can develop a trusting relationship and through that hopefully have more open disclosure of mental health problems. So if they're relying on self-report, if there's a strong relationship there with the person under supervision, then they're more likely to be open about any mental health challenges that they might be having. Then finally, the report points to a need for more information on the effectiveness of interventions that people receive. Again, echoing what we found in the systematic review that we conducted recently. It recommends training for probation staff and also more joint working between probation staff and mental health service providers. So that was a brief overview of what we know about the mental health needs of people on probation and the challenges around meeting them. And I thought I would end with some questions for you to consider, and you might want to focus on just one or to discuss all of them. That's up to you. So is mental health provision for people on probation adequate? And if not, how could it be improved? How could probation staff support improvements in this area? Can you provide an example of good practice in this area? And are the difficulties faced by probation a reflection of wider challenges with mental health provision? And if so, how do we fix this?